Have you ever noticed a sudden change in your loved one, or maybe even yourself, and wondered if it could be something serious? Most people assume that signs of the body slowing down or acting strangely are just old age. But here's the truth that few want to admit. In the final months, weeks, and sometimes even years before the end of life, the human body sends out subtle but surprisingly clear warning signs. These changes can be easy to brush off or ignore, especially when they're mild or come and go. But studies show that nearly 8 out of 10 seniors who experience specific warning symptoms never mention them to a doctor, and that silence is often the reason treatable issues are missed until it's too late. Would you recognize these signs if they appeared in yourself or someone you care about? Stay with me, because the most important and the most misunderstood early warning sign is coming up at the end. Do not miss it. It could save your life or the life of someone you love. Why does this matter so much? Because it's easy to believe that weakness, strange behavior, or unexpected changes are simply part of getting older. But research from major medical centers has proven that many of these signs are not just about aging, and catching them early means there is almost always something you can do. In many cases, small changes, the right support, or even a single conversation with your doctor can completely turn things around. You are not powerless, even if it sometimes feels that way. The worst mistake is to stay silent and hope things will get better on their own. I want to hear from you. How old are you? And have you ever noticed a strange symptom in yourself or someone you know, but kept quiet about it? Write your age and your story in the comments below. If you've ever ignored something because you thought it was just normal for your age, type 1. If you always talk to your doctor right away, type 0. I read every comment because sharing your experience could help others who are feeling the same fear or doubt. Let's talk about the warning signs that too often appear before serious decline, and what you can actually do if you spot them. I'll explain each sign, why it matters, and a simple practical step you can take right away. The first sign many people notice is sudden or unexplained weight loss, even when eating habits haven't changed. You might think, maybe I'm just eating less, or it's good to lose a few pounds. But research from Johns Hopkins shows that losing more than 5% of body weight in 6 months without trying is often a major red flag, especially after 60. This kind of weight loss can be linked to cancers, heart failure, or advanced diabetes. But even less dangerous causes like thyroid problems or depression are much easier to treat if you catch them early. If you or a loved one is losing weight for no clear reason, write it down, check your weight once a week, and mention it to your doctor, even if you feel fine otherwise. Something as simple as keeping a food diary can help spot patterns and prevent dangerous drops. Another sign is a sudden change in memory, thinking, or mood. Many people expect a little forgetfulness with age, but a rapid shift, such as getting lost in familiar places, trouble following conversations, or sudden confusion, should never be ignored. According to the Alzheimer's Association, nearly half of all older adults who develop dementia symptoms wait more than a year to mention it. And yet, early detection often leads to better treatment and a slower decline. Even more important, sometimes confusion is caused by infections, medication side effects, or even dehydration, which can be fixed quickly. If you see someone suddenly acting not like themselves, gently keep notes on when it happens and bring it up at the next checkup. Encourage regular brain activities, puzzles, reading, even simple conversations, which have been shown in studies to help maintain mental sharpness. A third sign is persistent fatigue that doesn't get better with rest. Feeling tired after a busy day is normal, but ongoing exhaustion that makes daily life harder may be a clue to underlying issues like anemia, heart or lung problems, or even certain cancers. Researchers at the Mayo Clinic found that chronic fatigue was one of the top 3 symptoms reported by patients in the months before a serious diagnosis. If you feel tired all the time, or if normal activities feel like too much, try tracking your sleep habits and energy levels in a small notebook. Are you sleeping at least 7 hours most nights? Is your tiredness worse at certain times of day? Bring those notes to your doctor because they can help pinpoint the cause. Watch for swelling in the legs, ankles, or feet. Many seniors think swelling is just part of bad circulation, but significant or sudden swelling, especially if it happens along with shortness of breath, can signal heart failure, kidney problems, or dangerous blood clots. Swelling that gets worse in the evenings or leaves a deep mark when you press your finger into the skin needs attention. If you notice swelling, try to elevate your legs when sitting, avoid salty foods, and check your socks for deep imprints. But most importantly, don't wait. Schedule a checkup, because blood tests and simple scans can often reveal the cause before things get worse. Loss of appetite is another warning sign, especially if it happens along with other symptoms. Many older adults eat less than they used to, but a sudden lack of interest in food, especially favorite meals, is a big clue. Research from the National Institutes of Health shows that appetite loss is often one of the earliest signs before a major decline, and it is linked to poorer outcomes in hospital patients. If you or your loved one is eating much less, try offering smaller, more frequent meals and make sure fluids are easy to reach. If chewing or swallowing is hard, switch to softer foods and soups. But do not ignore ongoing appetite loss, especially if it lasts more than a week. Ask your doctor to investigate. Have you noticed a persistent cough, new hoarseness, or shortness of breath that does not go away after a cold? These symptoms can be easy to ignore or blame on allergies, but they may signal lung infections, heart problems, or even cancers. According to the American Lung Association, more than half of lung cancer cases in seniors are caught late because the first symptoms were brushed off as just a cough. Track how long a cough or breathing problem lasts. Anything longer than 3 weeks deserves attention. Breathing exercises, staying hydrated, and avoiding smoke or dust at home can help, but do not delay talking to your doctor if you notice a new or worsening cough. A sudden change in bathroom habits, such as new constipation, diarrhea, or trouble controlling urine, can be awkward to discuss, but they are important. Changes in bowel or bladder function can be early signs of infections, cancers, or problems with nerves that control these organs. For example, new constipation combined with stomach pain may point to colon cancer, while trouble urinating could mean an enlarged prostate or even early kidney failure. Keep a simple journal of symptoms, make a list of any new medications, and ask for help if these changes last more than a few days. Gentle movement after meals, drinking plenty of water, and adding fiber from vegetables or whole grains can support regular digestion, but always investigate new, persistent symptoms. Another warning sign that is often missed is new or severe pain, especially in the chest, back, or stomach. Many older adults believe that aches and pains are just part of life, but new pain that starts suddenly, wakes you up at night, or gets worse over time must never be ignored. Chest pain can signal heart attacks, which often present differently in seniors, sometimes as heaviness, nausea, or even jaw pain. Severe back pain could be a sign of fractures, cancer, or infection. If you experience new pain, especially if it's severe or unusual, write down what triggers it, how long it lasts, and whether it happens with activity or rest. Do not try to tough it out. Quick action can be life-saving. Pay close attention to new or worsening problems with balance, walking, or frequent falls. While falls are common with age, repeated falls or a sudden increase in unsteadiness are never normal. The Centers for Disease Control and Prevention reports that falls are the leading cause of injury-related death in adults over 65. Weak muscles, nerve damage, poor vision, and medication side effects all play a role. Strengthening exercises, reviewing medications with a pharmacist, and making the home safer, removing throw rugs, installing grab bars, improving lighting, can greatly reduce fall risk. If you fall more than once in 6 months or feel unusually wobbly, ask your doctor for a falls risk assessment. You might not expect this one, but new or worsening wounds, bruises, or skin changes that do not heal are another big red flag. Slow healing wounds are often the first visible sign of diabetes, poor circulation, or even blood disorders, and some cancers. If a small cut takes weeks to close, or if unexplained bruises appear, especially on the arms or legs, it's time to get checked. Keeping skin clean, using gentle moisturizers, and protecting skin from injury can help, but new or rapidly spreading skin problems should always be evaluated by a professional. Finally, the most misunderstood early warning sign, and the one people ignore the most, is withdrawal from social life and loss of interest in favorite activities. It's easy to think that losing interest in seeing friends or stopping hobbies is just slowing down with age, but social withdrawal is often the very first symptom of serious depression, early dementia, or even heart disease. Research from Harvard found that seniors who become suddenly withdrawn have a much higher risk of hospitalization and even death within a year. Staying connected, joining group activities, or even regular phone calls with loved ones can make a powerful difference. If you notice yourself or someone else becoming isolated, do not dismiss it as normal. Reach out, ask questions, and seek support. These signs can feel overwhelming, but here is what you need to remember. Your body is always talking to you. Even small, persistent changes deserve attention. Ignoring them is never the answer, and it is never just aging. In almost every case, getting help early makes things easier, safer, and often reverses the problem completely. Your health is worth fighting for. Even small changes done regularly can make an enormous difference over time. Remember, your body can heal, recover, and grow stronger no matter your age, as long as you give it the right care and do not ignore warning signs. You are never alone in this. Thousands of others have faced the same fears and doubts. And with the right support and information, you can take back control of your health. If you found even one tip in this video helpful, please take a moment to like, subscribe, and turn on notifications so you never miss an update. Share this video with friends or family who need to hear this message. You never know whose life you might change. And tell me in the comments, which sign surprised you most? Is there another symptom or topic you want us to cover? Your stories and questions help us all learn together, so do not be shy. Take care of yourself and each other, and remember, it is never too late to listen to your body.